Welcome back. I'm here with our second guest for this evening, Dr. Khalid Al Sabti. He's a retinal surgeon. Hello and welcome to our show, Doctor.
Hi, and thanks for the invitation.
It's always a pleasure to have you here. And I'd like to start off with congratulating you on the new device and innovative idea that you have for the surgery of eyes. So can you tell us more about it and what can it help and benefit?
Okay, first of all, let me explain what is retina surgery, because this is all is related to retina surgery. So just to explain to the audience, retina is the inner lining layer of the eye, which is responsible of transferring the light signals into electrical signals, which is transferred to the back of the brain for vision. So it is the most important part of visual pathway, which is the first one. And everything else is the cornea and the lens is just the role of this is to focus the light to the retina. So anything can happen to the retina can affect vision.
Okay.
So for us as a retina surgeon, we perform retina surgery. And retina surgery is one of the most advanced surgical specialty in ophthalmology and in medicine also. And there has been a lot of improvement over the past 20 years, particularly in retina surgery. Well, everything else is also has been improved, but the retina surgery, so we became more delicate, we became more precise and more predictive. So what is the device is we use it for a procedure called vitrectomy, in which this is the first step. We remove the vitreous gel from within the eye. Every person has a vitreous gel, and sometimes this vitreous gel cause more harm than benefit, and we have to remove it. And
if it's extra or if it's less, depending on the normal amount?
Depends on what is the problem. If there is bleeding, we have to remove it because of bleeding. If there is retinal detachment, we have to remove it so we will be able to fix a retinal detachment. So the device is called Vitrector or vitrectomy device. And what happened in the past, let's say 10 years, the device, this is what we are using, is becoming smaller and smaller and smaller in size. And the reason why we need it to be small, because we want the eye to go back to normal as soon as possible. So, for example, if you make a large incision in your skin, it takes longer time to heal.
Yes.
If you make it smaller, it heals faster. So it's all the same concept.
Thing. Okay.
So this device, the Vitrector, is becoming smaller and smaller, starting from 20 gauge or 19 gauge, which is really big, to now it's 27 gauge. But the vitreous characteristics is the same. So what happened when we moved to a smaller device, the procedure became much slower because the instrument is smaller.
How long are we talking when it comes to the surgery?
When, for example, if we compare the 23 gauge, which is like everybody's using it, which is fast enough for us, the procedure takes about 15 minutes to 20 minutes. When we moved to 27 gauge, it took 3 to 4 times slower. So it takes about 40 minutes to 50 minutes.
Okay. But it's the same process, doctor?
Same process, but slower. So imagine if you have 2 cars, one fast car, one slow car. Both you reach your destinations, but one faster.
Different timings.
For us, longer procedures means we do less cases, and the patient sometimes cannot wait or tolerate longer procedures. So we have to be faster. So having slower instrument, that is why a lot of people or surgeons like me are reluctant to move to 27, which is the smaller Y. And they started to use the 23 or 25. So my idea is how to make this, which is everybody don't use because it's small, to a faster instrument. So basically what I did, I modified it to make it work faster.
Very interesting. And what were the modifications and how were you able to get track of time and make it in a shorter time than the usual?
Okay, so when you look at the device, if we have the video, is the original device has at the end of the instrument is only one hole, and this hole is responsible for cutting the vitreous and aspirating it.
Yes, right now on the screen we're looking at the video. Yes,
it has, instead of one, it has 3 holes.
3. Okay.
So it is 3 times faster. But as you can see here, it removes the vitreous from 3 different sides. And what is also important is also it's 360 degrees. Now, what is good about this device is important is that you, as a surgeon, can choose if you want to use the traditional one, which is the one hole during surgery, or should you choose to go with 3 holes, then you can switch it to 3 holes. So basically changing the speed as the surgeon wants. And sometimes not the whole procedure. We want to be faster. Some of the procedure will be faster and part of the procedure will be slower.
And would this manage to get the exact same time that you would have done previously with the thicker rod or metal needle?
Yes, exactly. Now, my device is 3 times faster. So it brings you back to 23 gauge, which is accepted by many people. And the reason why we don't use 23 gauge is that we need to suture the eye at the end. With the 27 gauge, we don't need to suture the eye. So if I give the surgeon the same speed as the bigger one without the need of suture, so that's a win-win situation.
And what about the procedure itself? Nothing changes, or is there like a few techniques that need to be done, especially because they're not dealing with one hole now, they have a couple of other holes to deal with?
It's the same technique. When we remove the vitreous from the middle of the eye, we call it core vitrectomy. Here we need the instrument to be faster, so we put it on 3 holes, operating 3 holes. And when we go closer to the retina, where it's very delicate, we switch it back to 1 hole. And just to show you the prototype that I have been working with, and this is what I tried and presented, is that this prototype, the same machine, it works on 2 directions. So you can put it on 1 or put it on 3, according to your needs during surgery. You can keep it as 1, and it works exactly as this one. So you don't need to change. But if you need to do a fast surgery, you turn it to 3. You do most of the surgery, and then if you want to slow it down, you can slow it down.
So it's all adjustable based on the doctor's needs and requirements.
And this is the innovation by itself, is being able to give the surgeon more than 1 option instead of having 1 option. Have 2 options. So you have the speed of 23, and also you have the speed of 27 in 1 instrument.
Very interesting, doctor. Now, this is the prototype. Have we seen this in real life surgeries right now, or we're still going to wait for it to take place?
Well, if you know that any instrumentation that deals with humans, it has to go through a very long process. And I think it needs a few years to be used for patients. So first of all, what we do during any innovation is that we do the design, and then we test it in artificial eyes. And if we can run the video again, I will show you how the instrument is. We tested it in artificial eye, and the artificial eye, the behavior of the artificial vitreous is exactly the behavior of normal human vitreous. So the speed, we can compare the 2. So in when we tested it on the artificial eye, this is where it showed. Later on in the video, I'll show you that how we compared the 2 pictures between the artificial between the normal machine and the prototype one, and you're going to see it in a minute. So when we do the testing, we do it in artificial. Now, when we turn it to 3, this is where it is faster. As you can see on the bottom here, it cuts from 3 sides rather than 1 side, and this is the prototype I'll show you here, just to demonstrate that it works. 1 only working, and when you turn it to 3, it's 3 working. Now we will see in a few seconds how it works in artificial eye, which is, as I said, is a good. Here on the left side is the 3 holes. This is my invention, and the right side is the same invention with 1 hole. So this is comparatively, it's much faster.
Very interesting. And I feel that you've solved the problem that you had tackled. And as you said, doctor, it's going to take a couple of years, a lot of testing to make sure that it is perfected for the human eye. Now, if after hopefully a lot of successful tests, will we be seeing it all over Kuwait, or is it going to be in just specialized places?
No, I think if it is successful and it proved to be very effective in the testing and tested in human. Of course, human testing is also common stages that they have to select. You will see it in every hospital in the world. So this is what I hope, that one day we'll see that. That's an innovation from Kuwait to all over the world. And I think this is a big success to everyone, to my country, to myself, and to my hospital. So yeah, this instrument, if it works, as I presented during the meeting last month, and everybody was very happy to see it. And if this is being manufactured to a perfect instrument, I think everybody will love to use it.
Yes, the future sounds very bright, and hopefully it's going to be used internationally, not just here in Kuwait. And we wish you the very best and success when it comes to the device itself. Can you tell us more, maybe, if it's going to be used? Of course, this is all later on in the process. Will it be like, would the patient have to pay extra just to use this device, or it's up to the doctor to make those changes when it comes to the tools?
No, I don't think the patient has to pay extra, because this is the instrument which is being used now. It's part of the cost of the surgery. So if this is manufactured and instead of doing this, they're doing this, it's going to be maybe the same cost. So I don't think the patient will pay extra for this. It's actually, if you look at it, it is a big saving to the hospital, because if as a hospital, or me as a surgeon, if I take 1 hour to do surgery and you give me another instrument that I can make it 20 minutes, so I'm saving time. If I'm saving time to the hospital, means I'm saving money also. So even if the instrument, the cost is slightly higher, I think the saving of time and subsequently a huge amount of cost will outweigh the little difference in the price of this instrumentation.
Very interesting. Do you have any last words for tonight, Doctor?
First, thanks for the invitation. I think Kuwait has a lot of talented people who are working hard to improve medicine in every single specialties, not only in eye surgery and anything else. And I think this is the future. You know, innovation is part of development of medicine, and I hope everybody will be successful in whatever field they are.
Thank you so much, Doctor, for being here tonight with us, and we wish you the very best on your new creative idea.
Thank you very much for the invitation.
Thank you.